Your doctor has ordered a highly advanced cardiac PET CT study to look at the blood flow to your heart. In this video, we wanted to show you some of the things you can expect during your exam. First, you should know that you are getting a procedure combining two imaging modalities: the sensitivity of PET imaging, which stands for positron emission tomography, and the anatomy of CT, or CAT scan imaging, all in one minimally invasive procedure that will only take about 45 minutes to an hour. In preparation for this study, do not eat or drink anything that has caffeine in it 12 hours before your scan. This is important, as caffeine will interfere with the results, and the exam will have to be rescheduled if you have consumed caffeine. On the day of the exam, you must not consume any food 4 to 6 hours before the scan besides water. If you are diabetic, you should ask if your doctor has any special instructions for you before your exam. Follow your physician instructions for taking medication prior to your scan. Please bring all your medications with you, and if you have an inhaler, be sure to bring that with you as well. Day of your exam, you should arrive 15 to 20 minutes in advance wearing comfortable, loose-fitting clothing. Do not apply lotion, oils, powders, or body spray. Before being placed on the camera table, an IV is placed in your arm utilizing a small IV needle. ECG pads will be placed on your chest to monitor your heart throughout the procedure. Once prepped, you will need to lie flat and straight on the table. The technologist will place a knee rest under your legs and have you lift your arms over your head. An automatic blood pressure cuff and leads to the electrodes will be placed to obtain a baseline EKG and blood pressure. Once everything is set, the table is moved to a specific height to position your heart in the field of view. The first set of CT images takes approximately 2 minutes to confirm heart placement. This will be the longest time frame you will be inside the camera. Next, the table will move back to where your head is now, outside the camera opening. The IV tubing will be connected to the infusion cart. Once connected, you will receive your first injection of the radioisotope. The radioisotope is not contrast or dye. It does, however, contain low amounts of radiation. During the injection, the PET resting imaging begins. It is extremely important to remain as still as you can. Movement can interfere with the images and cause artifacts, so do your best to keep your arms, legs, and body as still as possible. This portion of the scan takes around 7 minutes to complete. Upon completion of your resting images, the stress test will begin. You will receive an injection of a pharmaceutical stress agent. Side effects from this could include shortness of breath, upset stomach, and/or headaches, but most patients don't feel anything. After the pharmaceutical stress agent, you will receive your last injection of the radioisotope along with your stress images. This scan is a total of 7 minutes and is looking at the blood flow to the heart after stress or exercise. When the stress images are almost complete, the technologist will come into the camera room to disconnect the IV tubing so they can take a 2-minute CT image. Once all the scans are complete, your technologist will check to see if you have any lasting side effects. The table is then moved down and you are unhooked. In conclusion, the cardiac PET CT procedure is a highly sensitive, specific, and accurate test that provides your physician with a wealth of information. This exam should take only around 45 minutes to an hour. You don't have to drink a contrast or dye. It is low radiation and could have minimal side effects.